Now we'll discuss iceberg phenomena of disease, indicators of health, Millennium Development Goals, according to the following learning objectives. First, we'll discuss iceberg phenomena, how to define iceberg phenomena, what is explanation of iceberg phenomena. Then we'll discuss indicators of health, what are various types, what is their explanation, and then we'll discuss various Millennium Development Goals. In the end, we'll summarize the session. Let's start one by one. What is iceberg phenomena of disease? Iceberg phenomena of disease predicts or shows the hidden mass of disease. Most of the disease cases are hidden. How they are hidden? Because they are subclinical cases. Because they are carriers, like in chronic disease, in hypertension, 90% of cases, they are not diagnosed, they are asymptomatic. Only 10% of cases report to the hospital and doctors treat them. Remaining 90% of cases are investigated by epidemiologists. Iceberg phenomena show that only tip is visible, whereas base, where hidden burden of disease lies, is not visible. So, iceberg phenomena show the spectrum of disease in the community. There are two spectrums of disease. One is in clinical setting, and other is in community. Iceberg shows spectrum of disease in community. Iceberg disease shows that 9 out of 10 cases are not being reported. Only 1 out of 10 cases being reported in the hospital. Most of the diseases has no latent period. Most of the diseases have asymptomatic cases. Most of the diseases have subclinical cases. Most of the diseases spread to carriers, like hypertension. 90% cases are asymptomatic, like typhoid fever. Reservoir is human being, but cases spread to carriers rather than cases. So carriers spread the disease and increase the burden of disease in the community. And in return, there is burden on health system. Mortality increases, morbidity increases. So an epidemiologist investigates these through screening. Screening is done for early diagnosis. Once the cases are diagnosed at earlier stages, prognosis is good. Otherwise, these cases are diagnosed at later stages, like in cancers. Most of the cancers are diagnosed at stage 3 or stage 4 when they become obvious. Then their prognosis is poor. When an epidemiologist does screening and do early diagnosis, these cancers can be diagnosed at early stages, like breast cancer, cervical cancer. Mostly they are diagnosed at later stages. For breast cancer, there are screening programs. For cervical cancer, there are screening programs. Breast cancer screening programs are self-examination, mammography. Cervical cancer screening programs like pap smear. So epidemiologists control the burden of disease. They try to reduce the burden of disease in the community. In turn, community becomes healthy. Our health status of community increases. Otherwise, if only tip is being treated or investigated, remaining burden remains untreated and there are a lot of complications. Outcome of disease may be severe. It can cause disability or death. We can say iceberg can reduce. By investigation of iceberg, we can reduce mortality, morbidity, disability. This is iceberg of coronavirus. Coronavirus is a burning issue nowadays. All of the world is facing this problem. People are dying due to coronavirus. People develop complications due to coronavirus. Cause most of the portion of disease is hidden. Cases are not diagnosed. They are misdiagnosed. There are subclinical cases, asymptomatic cases. Many people show minor symptoms, and these cases increase the burden because they transfer the disease. They transfer the disease to others. When one becomes diseased, he causes the infection and cause an epidemic and cause a chain. So it is important to diagnose these cases. When we diagnose these cases, we will isolate them. What isolation does? What is isolation? We isolate the diseased person. What it does? It reduces the burden. It reduces the transmission. We block the transmission of disease. In Pakistan, majority of population is young. So people have mild symptoms or moderate symptoms, or most of the people are asymptomatic. If we diagnose them, we can isolate them and we can protect our elders. Mortality is greater in them. Now we'll discuss various indicators of health. What they do? They predict our health status. They do prediction. They give a direction regarding our health system. They give a clue regarding interventions. What interventions are required? What intervention we should do to control the burden of disease? These indicators are mortality indicators. They show death. Morbidity indicators. They show number of diseased people. Disability indicators. They show how many people are disabled due to disease. And health system indicators. How our health system is, how it is working, how people utilize various services. Let's discuss them one by one. Mortality indicator may be crude death rate. What is meant by crude death rate? It gives a rough idea regarding total number of deaths. It gives total number of deaths. Like 10,000 people are dying in a population. We don't know the causes. Then we'll move to specific death rates. We specify the causes of death. They explain the cause of death. How many people are dying due to which disease? Which age is more vulnerable than standardized death rate or adjusted death rates? Morbidity indicators are incidence and prevalence. They show the number of cases. They show the burden of disease. Disability indicators are disability adjusted life years and health adjusted life expectancy. Then we'll see health system indicators. They are two things. One is provision of services. Then other is utilization of services. There must be balance among them, provision and utilization. Let's discuss them one by one. Crude death rate. Crude death rate shows total number of deaths in a community. They may be due to any cause, like we can say that 10,000 people are dying, or there are 10,000 deaths in Lahore. We don't know the cause. So, to know the cause is important cause. We have to apply various interventions. Then we move to specific death rates. Specific death rates. They show the cause. Like we can specify them according to age. We can specify them according to gender. And there are case fatality rates. A disease may be fatal. Then there are survival rates. How many people are surviving? The example of age specific mortality rate is infant mortality rate. It is most sensitive indicator. There is an MCQ. Which indicator is most sensitive? Your answer should be infant mortality rate. Then, if you divide according to gender, maternal mortality rate is the example. How many female of reproductive age are dying? Then case fatality rate. Killing power of the disease. Case fatality rate shows the killing power. Most diseases are not fatal, but some diseases are fatal, like rabies. Case fatality of rabies is greater. Then We can give example of survival rate. How many people are surviving due to cancer? These are the various specific death rates. There is an SCQ that enumerate various specific death rate. Your answer should be age specific, gender specific, case fatality, and survival rate. You can give examples of infant mortality rate, maternal mortality rate, case fatality due to rabies, and survival due to cancer. Now we will discuss standardized mortality rates. What are standardized mortality rates? They are adjusted mortality rates. What is meant by adjusted mortality rates? We can adjust them according to age, according to gender, according to occupation. There are two types: direct standardization and indirect standardization. Indirect standardization, we know the actual composition of population according to age, gender, occupation status, socioeconomic status. So we may compare two populations. We may compare the health status or mortality status of two communities, two countries. Like we compare mortality rates of Pakistan and Sri Lanka. But if we don't know the composition, then we will apply indirect mortality rates or indirect standardization. Example is standardized mortality ratio. We only know the number of deaths. So we divide observed deaths with expected deaths. We expect how many people will die this year. But if the observed deaths are greater than expected deaths, this means our intervention has certain loopholes. We need to improve our interventions. New interventions are required. Then what are morbidity indicators? They are incidence and prevalence. What they show? They show the burden of disease in a community. If the burden is greater, incidence will be greater and prevalence will be greater. What is the difference between the incidence and prevalence? Incidence shows number of new cases, whereas prevalence shows new plus old cases, or we can say that total number of cases. Incidence, if incidence increases, prevalence may increase or decrease. It depends on mortality. If mortality is greater, then prevalence may decrease. But if mortality is less, prevalence will also increase with incidence. Incidence is rate and prevalence is ratio. This is a common MCQ question. What is incidence and what is prevalence? Your answer should be incidence is rate and prevalence is ratio. Now we'll discuss disability indicators. They are disability adjusted life years and health adjusted life expectancy. Disability adjusted life years shows the number of years lost due to disability or premature deaths. When one becomes disabled, he will not be able to perform routine activities. He can become handicapped. Health adjusted life expectancy shows how many number of years a person can live after disability. A person becomes disabled, how many years he will survive. Then we will discuss health system indicators. They are provision, services which are provided by government, and utilization indicators. Provision indicators will be doctor-patient ratio. In developing countries, it is greater. Utilization indicators, family planning services. How many services are being utilized by the community? Patient bed ratio is also a provision indicator. And vaccination, how many people are using vaccination services like in coronavirus. We can give example of COVID-19. Government is providing vaccination services to the whole community, but how many people are using these services? Other provision indicators are patient-nurse ratio, and utilization indicators may be EPI services, expanded program of immunization services. Government is providing vaccination services to every child. How many people are using these services? There must be some balance between them. These services should be provided on the basis of equity, according to needs of people. If our population is not using family planning services, we have to see whether they are eligible for this or not. Then these services are utilized by community participation. So community participation is essential. When community participates, they will utilize these services. So two principles of primary health care are required here: equity and community participation. Now we will discuss various Millennium Development Goals. WHO has set 8 Millennium Development Goals for developing countries. All the goals are meant to be met. What these goals are, why these goals are, what is the significance of these goals. We will discuss them one by one. What was the first goal? Eradication of extreme poverty and hunger. Many people of the world are living below the poverty line. They can't afford food. So children are hungry, people are hungry, they become malnourished, they develop the disease. We have to reduce this disease, we have to reduce this burden. So World Health Organization decided that poverty and hunger should be eradicated. And this was the goal. And what was the indicator? Indicator was malnutrition status. We see malnutrition status of children who are under 5. Then other goal was universal primary education. Primary education should be provided to everyone, regardless of country, regardless of nation. Then other goal was gender equality. In developing world, there was no gender equality. And women empowerment. Females should be empowered. If female will be empowered, they will become productive citizens. They will decide, like in maternal mortality is greater in developing world because females don't have the power to decide whether they should go to hospital or not. Decisions are made by family members. Fourth goal was to reduce child mortality. In developing world, child mortality is greater. And we can see this through infant mortality rate, which is most sensitive indicator. Child mortality can be reduced by vaccination, by providing food services, by immunization. And other goal was to reduce maternal mortality. Maternal mortality is linked with child mortality. And the indicator was maternal mortality rate. If we are able to reduce maternal mortality, we can reduce child mortality. Healthy mothers will provide healthy children. The sixth goal was to combat with HIV, AIDS, because the burden of AIDS is increasing. Tuberculosis. Tuberculosis is a common problem of developing world. Malaria. Malaria is a common problem in Africa and Asia and other communicable diseases. Because living standard of people living in developing world is poor. So burden of communicable disease is greater in developing world. We have to reduce them. How will reduce them? We'll see how many people are using condoms. We can reduce HIV/AIDS. We can reduce tuberculosis by increasing the standards, living standards. We can reduce malaria through vaccination, through nets, and other communicable diseases through hygiene, health education. Seventh goal was environmental sustainability. With growing population, environment is become polluted. There is air pollution called their use of vehicles. We have got the trees cause population burden is increasing and they have to live. They need some place. So we'll see environmental sustainability, number of consumption. We are consuming oil, we're consuming wood, we are cutting the trees. This is increasing air pollution. This is increasing global warming. Eighth goal is global partnership. World has become a global village. Some countries like India produces majority of vaccine. It supplies these vaccine to the world. Our coronavirus vaccine is being made by 8 countries. They supply this vaccine to other countries. They collaborate with each other. They partnership with each other. So world needs to do this. World needs to provide services to other countries. These were 8 goals. If you discuss them, these all goals are interrelated. What was the priority? WHO prioritized the things. Number one priority was eradication of extreme poverty and hunger. If we reduce the hunger, if we reduce the poverty, then we will go to primary education. Then we will move to equality. Then we move to child and maternal health. Then we discuss to reduce the burden of disease. Then environmental sustainability and global partnership. Now, in the end, we'll summarize this lecture. We have discussed iceberg phenomena of disease. Iceberg phenomena shows the hidden burden of disease. There are 2 spectrums of disease in the community, clinical spectrum and spectrum in the community. Only tip is visible to clinician. Remaining 90% of cases are not visible. They are investigated by epidemiologist. When he investigates, he does screening. By investigation, by screening, by early diagnosis, we can reduce the complications, we can reduce the burden, we can do intervention. We discussed iceberg phenomena of coronavirus. Most of the cases are subclinical, asymptomatic. Most of the people show minor illness. So we have to investigate them, we have to isolate them in order to protect our community. Our aim is health promotion, health of community, or healthy community. Then we discussed various indicators of health. These indicators predict the health status of a country, like mortality indicators, morbidity indicators, disability indicators, health system indicators. Morbidity indicators show the burden of disease. We describe them as incidence and prevalence. Mortality indicator shows how many people are dying. They are crude death rate, specific death rate, standardized death rate. Then we discuss disability indicators and health system indicators. There are health provision indicators and health utilization indicators. There must be some balance between them. Government provides the facilities, government provides the budget. We see doctor-patient ratio, patient bed ratio, patient nurse ratio, number of hospitals, and utilization indicators are family planning services, vaccination services. How many people are using these services? Government is providing EPI, expanded program of immunization, vaccination services to every child. Government is providing coronavirus vaccination to every citizen. So how many people are using? We have to maintain balance. We have to provide these services according to equity, and community will use when we will apply community participation principle. Then we discuss various Millennium Development Goals. WHO set 8 goals for developing countries. If you discuss them one by one, what were they? Then we discuss Millennium Development Goals or MDGs. 8 goals were set by WHO for developing countries. First, they started with eradication of extreme poverty and hunger. Most people of the world are hungry because distribution of resources is not proper. Then, primary education or universal primary education. Third goal was gender equality and women empowerment. We have to empower our female. Fourth goal was to reduce child mortality, because infant mortality rate is greater in developing world. We have to reduce this. How we can reduce this? Through vaccination, through immunization. Then fifth goal was to reduce maternal mortality. We discussed the sixth goal to combat with HIV/AIDS, tuberculosis, malaria, and other diseases. Seventh goal was global partnership, and the goal was environmental sustainability. All these goals are interlinked, interrelated. WHO prioritized these goals according to resources, according to world population. So, this is all.